The difference between a vitamin D deficiency and insufficiency, I think, is often misunderstood, so I want to clarify just a little bit. A vitamin D deficiency means that you failed your blood work exam, which means that your vitamin D is below 30, because the normal range on most labs is 30 to 100. A vitamin D insufficiency is anything between 30 and 65. Why 65? If you look back to the research posted by the CDC, which I know a lot of people don't have a lot of faith in, but this is them reporting actual data. From 2020 and 2021, even the beginning of 2022, they looked at the first 546,000 people that were hospitalized or ventilated with the SARS-CoV-2 virus. What they found is that when people came to the emergency room and their vitamin D was above 65, they needed like a breathing treatment, a little bit of saline support, and were sent home. The people whose vitamin D was below 65, they ended up hospitalized. And most of them, until they could get their vitamin D levels up to 85, were ventilated as well. But when they got to 85, they no longer needed to be ventilated. So deficiency and insufficiency are different things. The lab normals are everyone who is getting an A on their blood work through a D on their blood work. The deficiency are the people who are failing the blood work exam. What I found is that for most clients, they feel better somewhere between 85 and 90, but then I have some autoimmune clients who feel better up at like 104. But not everyone will do well with supplementation, and that actually has to do with genetics, and there are some factors at play that you can adjust to help your genetics perform better for you. Some other reasons that you may have a vitamin D deficiency or even insufficiency though, and still have like a high calcium level in your blood. You may have a parathyroid disorder and they need to test that hormone. And if they aren't testing that and they aren't willing to test it, you got to find a new doctor. And then I've heard the argument too, well, I can't get my vitamin D tested because it's like $247 if I go through my insurance. Don't go through your insurance. Walk into any lab test now, Quest, LabCorp, and say, I'd like to get my vitamin D tested and I don't have insurance. What's the cash pay rate? My bet, it's somewhere between $55 and $65 depending on where you live. Also on Amazon, there's a vitamin D test that you can get to do a home kit vitamin D test. $55 to $60 depending on where you live. Other things you may want to consider getting tested are your B1, magnesium, selenium, zinc, and vitamin A, because all of those play a role as well in your ability to absorb vitamin D. And those tests range from $12 up to $35. Sorry, you can get a magnesium test for $5. So for around $120, you could get both types of vitamin D that they test for in the blood tested. You could get your B1 tested, or thiamine, magnesium, selenium, zinc, and vitamin A. There are pretty significant links between thiamine, vitamin D, and magnesium deficiencies, and all types of autoimmune disorder stuff. So if you're worried about autoimmune disorder, including things like Hashimoto's, Graves' disease, MS, lupus, rheumatoid arthritis, Sjogren's disease, any of those, you could get these things tested on a cash pay basis for $120. If you need someone to order those labs for you and you don't live in the state of New York or Connecticut, use the Learn More button and type in blood work. We'll get on a quick call, get your blood work ordered, and you'll have it within a week.